Nonsi abogana de share mamu nyina joa mama kwa ba high power 97.9 FM and afa TV XYZ kasafonyini so Ghana mantem nyina obi atienka o TV XYZ so power FM ye ne affiliate radio stations awodo awono so afa Kasiebo to apete ama amanfo atienka ufri power FM high 37 BECE street ye nuanom volta powerful ewo ho from mantem san so global FM eno so ewo ho ape ukota krade atienka wo sharp FM na ukopiem so ewo nkran kwanta Nsoroma FM ena wote enka wo nkran kwanta ene ne mpotem Buam FM o jase ka wotima temu jinya me 107.7 FM wo sample German of German South ne time man sinimu amanfo te enka nananom 92.5 wa hafo go so da ba asutifi north asutifi south amanfo te enka ni asunafo south nyina Western Radio ewo lembele high radio ewo bichim ene ne mpotem boba kukuruwa omo nyina te enka KFM o paza Nkiligi FM Bole Atom local radio ewa asase trenzema elembele Loud Silence TV enso Kasiebo Kevin Taylor ne mrante Vinci radio ni TV odun kofe information centers no dos wonu nyina ka ho bi Kasiebo ebie radio SM online ka ho bi apostate of Virginia USA abuchimemo mo so Kasiebo bi tune in no hwehwe power 97.9 adafo power radio ewa Paris OPD radio enso ewa UK J Live radio enso UK na fe my xyzonline.com nsemi obenye bi akuchire akenkan asante yenka multi TV dege boss no so radio XYZ na fe TV XYZ when price and power FM wo pusiga worum nyina ka ho bi a wo fa Kasiebo e de ato apete ene enwumre nsema ya tera se de baba so mo enwumre ndi eduma akotere ni bi ene step nanu ya de betu dwa kire mo se wonom akọ hospital a wo yare a yetwe mo gya hwe odunso mo ni ade from medical lab workers wa mu kire mu se wa mu sika se mo ntoto ya ban ene omo bocha skele bi wo mene nje ho nti omo de omo nnade na omo mpane nyina gu fom wa mu kire mu se wa mu strike ne de wono mo enje mu na enje mu kina de na wono mo hwehwe enumre ye bebo ho nkomo
so ana imrashe betwani a owo Bole ade atudwa stress osofo a ohwe afisam so nhwambo o moisane so mo ntimi nshom ho nhada sa wambro mo nya biboni bia ewo ntem ho
so afọ wono ehwe Ghana ehode ne so energy minister Dr. Matthew Opoku Prempe dodo na Fred Napo wachire mo se asa onka ne duduma enye ECG fo na ehwan mo a ye bechirim
so ana Ghana celebrities bi ade to dwa chirem se na mbere bia aya Food and Drugs Authority akwagina makwaje wo court no enya de a ebebo mu
na ansha yenuanom ne ofasefo ne ye mana wo mokotwo BECE afe no ansha data wayekefo de abaso motwero no ebia na amaso ni nyina ne se aban ne wayekefo sikasem wantwi bi aba aban sika no wo he yebetu ama wayeka na yentua ehun nsem ha
so ana cadres adin sembi atudwa na mo kirem se nei sadie nipa bi ekokọ man Ghana mu no enya de eye aniso
abishafo nsem we ni nsem afoforo pi na ya tira se na nwumre ede baba so mo se no nsia bremo Kasiebo TV XYZ ene Power FM se wutie ye wo radio so na pese do adwen kire ba ko Facebook na we TV XYZ Ghana wadwen kire no fa ba bekin kan nyina enso ede ama sanso ena wo Facebook wan so abetima we Power 979 FM Power 979 FM ye chuo ni nyina yentintem like page na follow na Kasiebo share na amanfo so ente yen kada fa adwen kire bra emre premier bekin kan ni nyina enso e de amount na Kasiebo ya de bra mu yi adwumakuo bi aso ya sene ex natural mineral water ensu papa wono ma betuma boa wo pa ama bibia konkan eyio outdoor no party wedding no ni nyina nsu papa ye nyina ye nom no pedodo tu abrafidwem ha wono ma dawro ma 0596273547 o frampage for ebejo so enwachi solar natural clinic etayechi Spanish ginkgo capsules eboa ema se wenyina refia de a ebetumi aboa no eno so elka ho be Ruta natural products de malaria do ba kwa ba friend Ruta mixture etu ase triple garlic mixture eye edura eyi mojemu fi konekope bi wo pharmacy shop biemu Power Specialist Hospital udon pemi obu hepatitis B fatty liver omo ya de pa Sabach Herbal Center eka ho bi SM test eyemema obedu mensem Dr. Edu Herbal Clinic de aba wo mankesim Benficrum Ostek Real Estate eka ho bi won sase sem won kran ha de woni problem Let's Talk Educational Consult for obane bratation ngwa ye behwe no 12 months won kosuku won trefie Little George Health Shop eduro bi a wo pe bia ye bibiduro Tema Community 5 na ye woko ho ebeboa Medimosis and Herbal Center eno so eboa prostate issues wo sen mo yade bra ye betuma aboa ye wa dental ni police station edi hwani mu aboafo bi ka wo bi ena nwumre yatra se de nsem ye so mo medi edi PSC Okra Boys Prefect Chief Tankers Honorable without constituency matrase ena nwumre na ye wukuada timinim wukuada nua ba
Akuya Kurantama.
And I atra CNN in semi eba besumo. What do you do Facebook Power 979 FM and afi and so TVXYZ Ghana Fabra. Afi young ran 7 bobro don't show nina emo. And then penny for one more lab technicians our more ya asupita udomo and no chip compounder. Utri ya utumi shebu ho ko district hospital bi aso a ebu ho kolebu ebu ho konfa teaching hospital ebu ho Ridge hospital ebu ho. One more rescue aban and a form na no no mka mo working conditions no eyadia enkoyie enu nti no aban enhwe mo wo musika sam totoe ho ebi beje maintenance fee ebi beje extra clothing allowance o se fuel nsuo ni nyina aka ho bie na adwuma no ema ne yede efiri se eye ofin hu nsuo no enua bi na yede no anadwene kama pa nti se nde ya wo mde galamse ase ni nti o kire mo se wono musu di bie yeye ti se na doctor fo ni di bie efiri se wo yare na akwa supiti a umoje mu doctor onto bi hwe ni mu hu ni ewom just all the call lab technician for ho wo twu umoja na wo hwem wo mo na hwe ya dwunso mu ne enema ewo ye honama kwa mu a obetuma hwe yare no se na ni su ene ne ban esitie wo mo chem se sa ban egitum se sika wo mo hwehwe ne enhyehye da wo no madwuma ho no wo no mo ebetumi aban to bi ka emani koyie dia ene na etu nkotwere bebi etwere wono mo ebetumi atwere mu kama pa wo hwa wono mo akwa atwatie mu wono Ministry of Health Fair Wages and Salaries Commission ehia lab scientists for meeting wono ma tumi wo ma no anko benkrom nti wono ma sori firi meeting no mekoye na lab scientists negotiation ya wodoi wo de niam makomakudu nwotwe ena ato table so de kira ban se enema we na ehia se de be adwuma ebetumi akon na so Ministry of Health aya no ho kwani wontumi emwa ema niam entumi nkonkan ebi ya communication uniform on sociable and special project allowance finance ministry wa twi de ti se panyin bone a wote bedwem na wa yimfra mabone ema yede akwakwahye nkora eti anam so ba wono madwalai pa wo mo ede wono mo enna de eguo sesi enu meeting ekoya nkwankosi agai edien ene be free mo enso ede aba na ye neten de a ene na ye be kwa homa no so na ye ne medical laboratory professional workers union panyin ba kwa woda emu enso Dr. Edu Jesse wono public relations officer wakasa ede makoyi a wono mo atuatie mu a wo mo kire bi se wono mo kwa asupiti ho ne enko ho kina obi antumi ndo mu foko efiri se na esa aban ede mo no aban fa ma mo nti wono mo ede wono mo na de enso ede egufo ma wo mo kire bi se aban emwa on sociable allowance no edu so obam se ombekire mi se party omonta nkobi wono madwuma wo da hospital sa na yatwe moja utiri anye ya yareboni bi wo obi moja mu a otwe na pane bi wo wa na ese wonso ode ko ene emu atepo ye muti yade ene niam a wono mu hu nyasam keto nti aban ese wo gina brane na ohwe na wono mu sika sem na wo madwuma ho nhyehyɛ no enu so tumi koye ti Fair Wages and Salaries Commission Ministry of Health and Affairs so ye hwe sika sem ntoto so Finance Ministry ene so ototo niam yie ede boa mo na face asika sem no ntotoye na allowance alawa no etumi eba yensaka Dr. Edu Jesse a wono kasa edema medical laboratory professional workers ya wono mo Ghana ha yena no batwetwe nkoba emre premier saka no so a yebekọ executive director edema the Africa Center for Health Policy Research and Analysis Dr. Thomas Anabaye kare wona na oda Ridge Hospital ano eba pomudi wonsema wa bi wo mu yebekọ kobisa no se na adwenkyere eho etesen Dr. Edu Jesse wona okasa edema lab technicians ya wono mo akọ strike anase etuatie mu yi yema adwuma akọ abadeba TVXYZ na fe Power FM so.
Medical lab professionals.
Medical laboratory professional workers union. Ona akasa mo. Na sesi mo se montwe nsan da. Montwe nsan mo betene fie akọpe bi se aban ebeboa na afi ne mo hwehwe ni nyina no. Mo nsa aka. Na mo ko meeting na mo ne Fair Wages and Salaries Commission for hia ene aban panyimfo no. Den na mo anu anko benkromi.
Wow. Medical care yeah, can you say? It's a Fair Wages in the day. Why is a revenue or the employees and the employer ebeba na adwuma wo ha le yema wo no esu akatua kanie ho allowance de be ma wo nie ne sa niema it is an employer no mo no an kan je pay wages say so sa adwuma ku we no de ka say na me wa make me de di omo huduma enti ni omo enka na ye he babia betimi aka kwejina wontimi enya fe atana bi pe ontimi nya fe enti de akopa nyina ne say abaying over all this period for almost 2 years. There's a proposal for that. Juma ye Yasia Fanina said the Juma said you'll be a Juma as medical lab professional. Akatuaka was a for the buying. I had the best one Casa. I buy Emma fair wages for Monday to be. That is a year. I buy Emma fair wages budget there. You was to say I did to their boss and control. So, and you could be an fair wages, you know. Cafe or Kakurana will just come out. And for all the periods, the government does not show up at the negotiation. And it's a time or Muko show up Monday or Monday by for issues we are talking about 13 of them. A movie in the Monday home Monday. There's a Buapayo, a ABR. Who say, well, Juma, we are no Basso also. Who say, was out to now, ye, Juma, no, in the Basse, ye can say, a betty and answer was answered by the 15th of this month. A year, Monday, Jordan, return. I say, I buy a doctor's why, yes, I did. And the Uber forward money, so you have a meeting at the area. And now, unfortunately, just as usual, and we knew they were going to do it. Abai never even got back past to have any discussion. And they said, you'll be able to do
Opanyi sametemuka ya na wo kase enema so far no manyane ntie se enema makoma kudu nwotwe 18 na mo hwe se aban ebeka ho asem wo se aban na je emumiensa pe na atumana
no the oka negotiations are your idea about financial commitment your idea any financial commitment the who say our financial commitment was here and they sort the issues out by 13 and I a movie look and I buy so on Monday. There, Yajitu Mukrana Obexmatia. Janasana. In the public domain, you are there to be green, they are almost green permission. But Adia, Yakase, a year to move Bexmatia, what Matia lab for Cano. For 13 issues, I can't watch them. A new troop and I buy say, or home Monday, I will be to be a character. So these are 11 of them.
Me tell you Ane.
Me say 11 of them no. Almost you almost say the money and from is money and for we just don't understand.
Okay. Nyambotre mame. Eti say aban kase wo emu mienu per mandate a opeso kire say no na obetuma tua na se eno na ewo mmeremu say say aban tua.
Yemfa no say no na no wo ho budget a obetuma tua.
Eti efie mienu a mo twen sa na ema we say no. Ifie mienu a mo twe no emu mienu pe na aban say afiwe obetuma tua mamo.
Sala ye be kanu.
Ndezi ada na mo ya fa ho.
But also a chance of a and let's conclude because it's quite unfair. Say, if we conclude or more allowances. Some of the things we are even talking about. What the tomorrow being moved to Yam almost in January. We also there from July. So what is the issue? Say, the only next with the account want them and Pessoa between. And I have to say, Piano, a honor on the there's a mini animal we are 3 of January. Be my July. Yeah, what on the budget. And you know, those are all the things that if we don't get agreement, the membership of medical lab professionals there.
Who say aban any certain dimodumanative because social healthcare value chain na so most mo kan ho bie obi aba hospital you say oyare ebia yare no enie yenkohwe ne dodo se na esitie yenkohwe mogem yenkohwe dwunso mu ne ade eti hu ne say aban hu ne say madwuma no nhyeda ehia no ntina wo twetwe ne ho ana
Oh, said the 10 nama, what years is said in Diana? Hey, Sana, Abia, etc. We can't think any other way around it because what me I did, some of the allowances are true for other group of people. What I say here. Now look at the car or the bay there. So everybody is right to come to the conclusion of what do you say. Abia, they are buying a none of this short my idea. And which they are required of us so I can't answer me the question like.
Na ba ka se won tumi tua ne aka no o hye mo boss e bia afia ye ba be wuremu yi na e mo hwehwe no wo mo behwemu ayi bia ba ama aban atua na
ba so bibia say ni ho na o he da bia e gina yi ne elections time ne ade anyway ebe de na o be pese be shebo beyond the current elections we are going to have. No one knows who is power next time. Now you ko shebo mo bi obitia. And you know the I was straight away who said na there yabo.
Hospital say ade a obia ko hobie na ene obi wo konfa no che teaching hospital obi wo kolebu wakọ esese okọhwe ni moje mu na munso muni hoi obi beka se nya Ghana for na mobo mutrimoden sa anya hwe no sanka akatua ne de ba.
Oh, unfortunately, we can be patient at any other time. And then we know that there is a hospital. In the obvious, you better say that you go with it, or you begin to move. And we think there was an in Arno. You have to say, which me I saw among them because they need the excellent, they have that money. Now, he not a quiet beer. One way and then, no, and then I have them. And that is what we don't hope. It's not that most say patient, which I can be. You can be, and anyone can be the next patient. It's really yes, I'm buying from the info. The intimate task is where everybody is break.
Mijawa Mako, it's my next meeting with Fair Wages and Salaries Commission near buying air dabbing.
20 and all hope you say a bit to me, SDI. I heard that it means Abasua.
Okay. Eno ya na otwi we amunti ma yenhwe se moye meeting wi a yebesa aba wonchen ene wa ba betwetwe nkomo yeda se ene mra wonya ene ya twetwe nkomo enwumre ya wo TV XYZ ne Power 97.9 FM so opinion Dr. Advocacy yeda se pa wono kasama for the medical laboratory professional workers union medical laboratory for no wo mo Ghana ha mo yedwuma aso piti nyina no wono mo nkabom ku no wono ne kasade ma o che se aban ebo mutrimoden enti for 2 years nya wono ma twe aban enyambae eno entina wo mo de wo na de agu fom enti ene ko hospital na kasa ko hwe mo gemu se bi ofa we Ghana bra na enhwem kodwunso bra na enhwem enya de a ebe ye firi se wo mo hwe saa ne manum no wono mo aban sika wo mo se saa kamuti no wono mo ede wo mo na de agu fom enti wonko hu mo asopiti biom Dr. Thomas Anaba penyi a wono eda Africa Center for Health Policy Research and Analysis ano wono kane wona no ye medical Doctor Penya na se penyi pa na oda Rich Hospital wa Accra ha se eba apomudi ho sama wa ben wo miye menko bisa ne se ede na aban enye ni ye na wo hwa aban ye kwani bia na ye hwe kwan ya befa so anya asem wei enso pomasibre Dr. Thomas Anaba about ka me ma adwoba akwa aba ha TV XYZ na Power 97.9 ye ne ya affiliate so sa medical laboratory professional workers union ni ye no ma kasa o mo se ene mama komako 30 no mo hwehwe fra aban ho aban si 2 na any mandate eti until say wo ma no be ko benkromo na wo hum nyina arrive at the same decision no nya dia wo no mo ebe resume strike no baby a wuti sa wo hwese na ene ma si kona adentina medical laboratory scientists no wo mo mpese wo no mo ebe san ko adwuma
me da wa se bebre na mi chia wo tie fo nyina a professional group, Emma government. And we all know that government here, the BECE or more, especially this current government, has a flexible models, and some are open. One is the conditions. So, conditions mean labor union and labor commission back at the condition it is not feasible. Labor commission issues conditions na catch the fact, but not from government to come and tell us that this is not their responsibility. And no responsibility. They are working for government. So once they are working for government and they think that these are allowances that they think can help them cushion their living conditions, the government has to sit with them to negotiate, either to vary them or improve upon them. But I would say that strike where me say government say with Omo now withdraw strike no na patients in no comfort because hardship too much. The health issues are the come then we are all being condemned to death because hospitals to give me. So what are the issues that government think is his? Then why that government hasn't solved those ones? The government say 2 issues out of the 13 handle. I didn't think that 100 are 2 issues 9-11. Then you say government are ADB. So I can't blame the laboratory workers association that much or union that much because with that experience with government with most of labor groups that are negotiating with government in the way that government doesn't come out clear and government doesn't really even fulfill the instructions given to them by the labor commission. So I would call on government to do whatever he can do to minimize the effect that the withdrawal of the services of the laboratory workers union is causing to Ghanaians.
So what share senior nema si kona obi a ho beka nkanka na obi a wayare akọ asupiti se ya yakase yantwimoja kra ma obi a sa na se accident bi esi na se ese yatwimoja ma obi ko wo ese yatwimoja ma omo a wo mo ene behwehwe mu Ghana for so every day bia nipa eko hospital ko wo accident nsu tumi esi eti sa nema ya eko so ya manfo bebre lab workers ni ho ya ede epra soronko ebe Usha aban edin na ese aban eye na right sene be ya ye ebetumi atoye
ese aban fan is in form na tie possible strike signals na sure say obetumi resolve this signals no you see the reason why obi be tell say we need allowance is simply because what it takes home is not enough. But once the living condition in the country is getting harder and harder, the people will demand for more allowances that they were not asking for. Just like government. The government who said Kana Onion and so on now are introducing new taxes. What is so almost condition is now almost thinking they come up with a new condition of service to improve their income and to let them cushion the challenges in the country. So in fact, if the economy is very good and the salary is not depreciating, it is hard that workers they demand for more allowances. So when conditions become tough in the country, it's not for that. And in fact, laboratory people withdrawing their services from the hospital, it means that we're going to have very serious challenges, complications in hospitals, morbidities, possibly mortalities. Because without their presence, especially in the government hospitals, those that are not private, patients are not going to get services. They have to crumble and rush to private hospitals where they are not even prepared because they don't have enough money to go to the private to acquire those services. So I think government should always put its ears on the ground. See, the effect too is, the reason is why people also demand these things is that if you check the direct, even an NG or Cocoa Board, the allowances that are given to him. Other state government workers, even state institutions, allowances that they get for their work. Some even get allowance for entertainment. Entertainment, when people who are working in laboratories undergoing serious exposure dangers to people's feces, to viruses, to bacteria, they don't even have the requisite allowances to cushion them. People have the luxury to even get entertainment allowance. Even get house cook allowance, even get some unnecessary clothing allowance. These people are asking for allowances that will reduce their risk and will compensate for any risk that is caused in the laboratory. So I think that even though I don't like striking groups, I think that we have to look at the need to really cushion them so that they don't make demands that would end up into strikes like this. And we should also look at how to make other people understand that giving you an appointment with so many amenities is detrimental to other people, not getting enough to also cushion them. If one director, CEO, can have all allowances that results in so much money going to him, and you, a staff of a hospital, is at risk, or a doctor is at risk, or a laboratory or imaging technologies is at risk, and there is no any allowance to cushion you, even your health insurance for a health worker is not there, then we need to restructure allowances in this country. And I'm happy His Excellency John Dramani Mahama is talking about scrapping certain allowances in this country. And I think that is the right way to go. We scrap some allowances from certain people and cushion other people who are not getting anything at all. So I would plead with the laboratory scientist union or laboratory technician union to temper mercy with justice and then sit with government quickly and resolve this issue so that our patients in Ghana would have the needed service delivered to them when they come to the hospitals.
Dr. Thomas Anaba, yada senimra wenya ediamaye ewo Power FM na TVXYZ ahwefo ni yetie wacheche nsemunum sene esitie emrepem bibini a ebesa ba wonche. Dr. Thomas Anaba, Executive Director Penyikwanche for the Africa Center for Health Policy Research and Analysis. Ono anso na no ye kane penyipa na wada Ridge Hospital ano watumi apapam sene esitie na obetumi de wadwenchira abasa nsem we ho we laboratory worker na say health professional allowance no ho nsem no betumi de wadwenchira aba na wonso ko hospital na okuhu ye no ka kire ye na afi ye nso ye hunu se ne esi etie ye to Kasiebo no so e de amamo
na Dr. Jessica so obi nhya wo obi mbetia nti no monti ase ye ti ansa no so na yanko yanim ye bohwi adiani achemu ewo eye Bole na imrahye badwani a all Bole honorable Yusuf Suleiman ede nsem bi atudwa express asuafo a ohwe afisam so momaden keka no ho se benese nansensem bi amma no ho so ewo eye Bole na fe wampatem no omonhwe ensiesie ne ntimbo ne nyina ne se ne no obeso na so da seni emu eda bonte na ede na se owu ya eno nsem na BECE basa se wo basa ne nyina no anya de aboa awontemo na no eno kirem se nam sayo so emese ne kopiem a Bole ne mpetema e kamia se nipa na mienu esanse nko akosi abonte mpe wonim ne odi wachi eje se obetimi abe obibie bu komu krama se wafi atiasefo asasi so nti osrese ntempia wo benya so mbehwe no matimi aboa na de ekoso no omatimi apanipo masibre na asumdwa basanse minto aso yadu bia piesie ede mayen
Amafo a ewo Bole a eno ewo Savannah region afade ato won ho se wobeye eye self-imposed curfew a eno akwotwere se won ankasa senia won kwa ehia won ntino wobeda ntem na efe nso won asanga sore eye ntem enam ekunkum a ekoso ewo saa won mpotem ho saa nnipa yi se wokum won wi a wode won koto biaye a eye nnipa etwam wo ho bebre na efe nso won honam akwa ne bi wo ho no ma na ayira fi ho eyi ama eye mmrahye edima eye saa mpotomi ekọ mmrahye begwafi no ode kotu gwa se eho akwakohia se eye interior minister eba bepuemu wo ho na wayi eye saa nsemmisa yi ano.
People of Bole are living in fears. Between May and June, 3 people lost their lives through serial killing. And this morning, I also read or I watched Metro TV and also heard that 2 people have been murdered in a very similar manner in Wa.
Honorable Abdul Rashid Pelpo, mmrahye begwani edema Wa Central. Na ono so di tu gwa se saa ekunkum ya ekoso yi ebi nso eyiniti edi ewo Wa municipality honoma eho akako hia se eye interior minister ene aposifo besiw ano animanim ya.
A trend is taking place and the trend is devious. It results in the deaths of people, innocent people, mainly watchmen who are on duty at night. The interior minister must also sit up. It's becoming too much for him to witness all this and not to tell Ghanaians what is happening. So, Mr. Speaker, apart from asking the police to do something about it, we are asking him to be present here to report to us exactly what has happened and what they will do to address this very dangerous situation.
Na FA eya nsawom adwagiri imrahebegwani Honorable Frank Anodombre enso de tuwa say sa nsemi a eye imrahebegwafo yi de betuwa no eya ade a eye ohaw yiye na FA odi adesrade eto eye Speaker of Parliament anim say obetonsa ede afre eye Interior Minister na wabepuemu wo imrahebegwafi na FA odi ne nsem aba betugwa.
Lives to be lost is unacceptable and our hearts go out there to my dear friend from Bole Bambwe. And so join your nation on the call for the minister to apprise the House on happenings. Just not too sure if we can give a date. You know, these are security matters and often we have to give the minister notification.
Nekrakra mu no eye second deputy speaker ene otena agwamu eye Honorable Andrew Esiama Amoako enso de to eye sa mpanfo ye animu se eho akohia se wone eye ministry si behia ene Interior Ministry na wonga pensem eye sa nsem yi mu na wonga sanga behia mu eye na wotwe se ne.
I will wish that probably you seek personal discussion with the minister first. If that will not do, then we can invite the minister next week to come. So my ruling is that honorable member try and get the minister and speak with him this week. If that is not possible, next week we will invite the minister here to come and brief the House Wednesday.
Na aya yadubia PSC amaniebo na muteye no.
Yefra kukumo nsemi so ayafa ye ne enchiremo ewo ensefoforo mu so afo wono ene hwe Ghana enyinama hoden nsem so anase ahoden ne nsem so ene eba petro ne ho nsensem ena afi eye yenyinama hoden ho nsensem a wono ene gina brane a wo hwe ho ensem ewo Ghana ha Dr. Matthew Poku Pempe dodo na friend napo wono no wansem ena making ode atodwa chiremu tintontan ese na nsense won kan edunduma enya de ese wo de sobo ebo Electricity Company of Ghana ye bi mu kura charity friend electricity come and go ECG yes kanea ne ba nyina so na esa akono mema yemfa sobo emmo mo na wo hwa Ghana ha se besa bosume ena enum ekoni enyina ma hoden a ese Ghana fo ye hia ewo man mu a ye de bebo ye ho bra na enumre te se free nonso ekopim no du peak hours no kanea hodo a ye hia na se kanea hoden a ye hia no enya de se ECG fo tumi ma Ghana fo bi enti enam so ema na se kanea dundum na ba na no ena wo kasa ewo mrahye fie wa bra na wabisa no question bi e de afran kanea dundum ekoso wo meamia bi obekasa nkade na nse nkane ne nkone so bekonkuru nketwa mu no wo ma wo ni kasamafo no obo se ye ya na yadum no eti se ye low shedding secret one ene obi oti ya okwe na yadum ne nkane obi oti subompan na yadum no obi oti ye friend se bo okurukuruwa na yadum no obi oti techimanti na yadum no fi se ho ne de woni obi amani nye dede mfa ho ena yewura matopoku prepe echire mu se eye low shedding na eba so na Africa na abone ni na ekọ na eba no enye ECG4 ena sobo no ese ye de ebo mo wo kire ni semu.
We are pleased to provide the following response to the urgent question. No, ECG is not undertaking load shedding as at the time the question was asked. Mr. Speaker, consumers were experiencing outages due to a number of factors. That included localized outages due to overload on lines and transformers. Mr. Speaker, there are certain areas in this country that all of a sudden the number of people resident or the businesses that have accumulated, especially I can give an example of parts of East Legon, which was a purely residential area, now has become one of the major business districts, increasing power consumption, thereby hampering the existing lines there. So the transformers and the lines have to be updated. Outages to upgrade the capacity of overloaded lines and transformers. SEMPA, Mr. Speaker, at the time the questioner put the question, SEMPA had an emergency valve leak, which meant a complete shutdown losing immediately 340 megawatts. That also contributed. And then, last but not the least, planned maintenance on our Mandi power plant was also ongoing at the same time. The emergency outages, sometimes also requested by a great company, had contributed. So there was a myriad of factors that unfortunately had happened that were causing power outages in different parts at different times. And so the reason why ECG went further to say that they were not load shedding, because most of those instances were not planned, and so they couldn't have come up or come out with a pre-program to say that.
It is our share, a for her Ghana, who Dindia Honsam, so Dr. Matthew Poku Prempe, and I will tell in Casa Wadin Samno to just say no crane, and yeah, CG for now, a year problem ni from. Na netia wanyina ne se eye transformers na eboa na afa nyinama ho de chene kakra kra wo impotem no eye na ebi wo ho a na power no aboro so na se eye nyinama ho de aye twe no edoso etiama eye friends transformers na you overloaded eno na eye na ema ne ba etiano localized dum so na Matu Opoku Prempre wa Canada de conenso no yenyina enim se afiwe ahyase January ebe pem eye bosome nsia ye wo mu eye se Electricity Company of Ghana enyama hoode ye hia ewo man mu ha no wontumi emfa maye free se wono mo enya sa enyama hoode no ntisa wo Energy Commissioner omon krata wo mo de eba abonten no kire se eye se eye Electricity Company of Ghana wo mo ntumi nya wo December 2023 se na enyama hoode a Ghana fo hia ewo ECG4 wono mo mantema ese wode nkane amaye no na 3618 megawatts na che se akona nim kakra ena afei so no wo hwe Ghana sabre bebi aye nam ya amanfo sidan foforo obi asi shop wakwakoji meter eti enyina mahode aye hia sesie 3788 megawatts we Energy Commission for wono mo enkrata omde aba na sa 3788 megawatts ade se enyina mahode ananse ECG de maye no ade a wono mo entumi emfa maye nto hwa wono mo June 2024 enyina mahode omde amaye 3101 itira se bebira akechira ECG for ntumi fa manti minister no so wakasa na me hu ni se parliamentary house of records na so no wakwa command records de na so ono ani Energy Commission wo mo data wo de abachire mu se minister na dintro
Yantua and some so na yanku anima na ise ne eye court kwa asetena na yebeka ise eye Food and Drugs Authority edin sembi ebeto abontin ejirem se Ghana phobia ise said ye can celebrities anasa omanfo je se omuye adwuma omanfo ni mo pa ise omagidin ewo Ghana baby ano omu ne ho kwan se bia ensa ombetimi abohu dawuro ewo kasa mfoni awodo so na ise timi abo omungina so ene se eno no betimi ahyenkunan emesesa ne so celebrate na dodo nim ninti no se nipa dodo nkwada nyina ebetu agusansa koro no so na se motimi akono no bia kama eba sanso na se bese nkrofo abrabo ewo manga ne mu na sasem na se ante de enam so me se tebiri elikogina court na nyame nchade abrebo ayipuma okwan mu ma court mpanyimfo akwotena asem no so atembuafo akwotena asem no so no se mienu agitumu efo so anka yamma kwan na celebrities na ntimi embodawuro ewo nsa no se timi abo mo so mo nsa kwoma no enna enum so se da bi ene je se ba ne sa de ntwa ye kura ntesa asem no said Food and Drugs Authority e kan no san hye na enna je se ebe ya dwuma na no enna abrantie be so no so se ba siniyia se wotwa bi papa se sanso na nsantwere dwuma yi odimu akotene eyowura George Kwei e de atodwa na wachirem se de akoso ne de enya de beboa se celebrities no craft sinitwafo ne ade no enya de a beboa moisa ne so mo so eno no ye kwan ba ko a omofa so enya sika na je se omunya bididie enya bi ede bo mo bra na se bi omoyere no omba ne amagese omunyina timinya bi ntia basa padia na se ade aho kire ebeba enti osrese Food and Drugs Authority nhwe sanke bi obetimi ni omo asi nkondwa na nke bi a omatimi ahye na sambra no magom kakra ede amom ensema se George Kwei ade tudwa wombre se ode ensem nchirechiremu ma wo court no mama yentie bi.
I don't think the war is between FDA and celebrities or people with a certain level of popularity. We're all seeking to, ensure that we have a safe society where kids can grow without being influenced negatively by anything. But you see, we always need to look at the broader picture. yes, you want to implement laws, but you need to implement those laws in such a way that you do not take food out of someone's mouth. Everybody deserves to be able to work in Ghana. Everybody deserves to have peace. Everybody deserves to be able to run their business and run it effectively without affecting other people negatively. So I keep asking myself, is it a war again between the FDA and celebrities? And the answer is a no. We've said it time and again that celebrities are people who can help raise children positively. They have a certain class, a certain following that people look up to. So you need to find creative ways to rather use them and endear them toward your brand and pull them to your side. You do not fight and push them away by passing laws that will make it difficult for them to feed. So I ask myself, so if, for instance, I'm sitting on radio tomorrow morning and I have an alcoholic beverage LPM in front of me and I read it, have I advertised an alcoholic beverage? If the answer is yes, because it's Josh Quay's voice on that product, and a man was driving his kid to school and they had that LPM, I've read that LPM, did you win or lose? You understand me? If another celebrity, if Andy Dosty is doing a show and he reads an LPM, if he is attending an event, say the TGMAs, and an alcoholic beverage brand is sponsoring, a segment of the show, and he comes, and then this particular category is proudly sponsored by that. Kids are watching that show. It will be shown during prime time. It will be shown during the daytime. Kids will watch. So what did you really gain? This is not something that I think the FDA should be hard and fast about.
Na no aye George Quay in summer auditu dwa no achi no owura aye ofori yate eso adibi tu dwa achirem se de kwane de ehom se ensam no ankoyi amfa amomo nanso de court aka no omu ni bibio metimi aye ewo achiri.
Judge did mention it was in the Bole case, and we're actually happy it came to them. We don't agree with the outcome, but we have to take it as it is. There's nothing else we can do about it. We definitely would still go on, probably find different ways to go about it. But at the end of the day, we still see some type of work that the musicians do with the brands, which is the alcoholic companies. So hopefully we have the ways around it. We really wanted a dialogue with the FDA as to what we can do, what we can't do, because the first time we talked to them, I think it came up as, let's say, a famous musician, let's say Sarkodie or Storm or anybody, is after years of doing music, they want to start their own, let's say, the beer company. They can't do that. There's things that we don't really know the limitations properly. So this is more or less not even to win or lose. It was more or less to have clear indications.
Nice, and also aye owura aye fori yate ninsimodi tudwa ewo astembua eba no achi no. You say untimi nkoya advert ni bi. That's well known.
No, say court ruling beba actually. Eba ruling no ebe kire kwan a obefa so aye no, because George Quay bisa question bi say ono no well known abaji start hi movie. Enye no sha. Na we ya ba benyi oyo obro 40 years. It is Sausha Ghana ha FDA for a petition and San Ebono. A home advert ye no after 8 p.m. It is caught in the ruling Baba says, oh, yes, celebrity. Ebia, Nasa was saying radio, Jumana say, Yababe Tria, FDA, I'm already am and I am Rase, won't to me and bo and some who de wuru, and say abro de wuru, until say an ajuno or triabo. It is ruling about to match, say, an ajuno or tribuna celebrity now say TV and a radio Juma, Ubutumaya and I went to me and teach the moon. LPM, the Basu
celebrity.
And because in this context, as a court to define it.
Obitimi kwa social media is an answer obi or celebrity. And also
yes, as a to make Kawasem. Yabako Ahomana so Wabraya to Kasiebo sono. Yane Ora William Boedi Equaco Casa, no ASCU, Edema Ekobi Anase, Edumekwe friend Educate Africa Institute, EAI. Nina saying, Yenuama, Yenuamema, your offer for Neyama. Our mbetro BECE Basic Education Certificate Examination now dey we JSS no afi anhwe ya maso ofisa wa yake se aban de omoka aban tu aka ni bia manaka 93,552 ana 93.552.68 na say 93 million Ghana cedis. Sika no doso. Aban nya ntwiaye. Enti ano so no mde be organize BECE no. If you say tembia say betro BECE ana say wasia. Aban diskako na yetumi de abia print questions e depend de bia tuatua o ma mekwakoye invigilators mark ne ho ade. Wo say aban nya mfa sika ne mba enti ama sesia BECE afi say betro say yen true aban de ka 93.5 million. So to the West African Examination Council, the charity of friend Wayek. No, 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 say now buy the budget ba. Now budget out the buy year 2024 budget. Ya read we bibia wom sika ko mabosika ne aban de sika bay nsuo kra aban beto kra ya tro. Nti adenti asasi kana kwa kokem. Wono mo hwe edisua ho nsem so okruma no. Ye no mbekwa kwatwe nkomo. Ya hwe se wura William Boedia wa homa no so enko bisa ne se wo mo na hwe education ho nsem okruma se na san nsem we wo mo hu ne se owura William Boedia ya ma Juma kwa baba TV XYZ to the Power FM so sasem we wote ya no na ensem bi say no mo amoye education ho eniema ya research ne ade no ebuma boma na se hu ni say aban no na edisika ntina ebi asasika ya kwa kokami
yo mamitia wone wotiefo minia ensem bi say no areho ne saye edugwase ema o man no Education Ministry no budget we see no I would say one of the ministries to care on now yes partly free SHS policy implementation program for the is a budget no also and you say na you need that budget no na e kwa adwuma ben no mo de e previous na awofo ene peer registration fee na wayeke fo so enya bidia ma omo contractors supervisors related eno omo e market exams no from examiners no edu be na bra ni say awofo ni nyai na ono aba ne fa saka ni na so obi a wutu sa na mo die na wo nim say wa bo mo dada but last year, 7 August 2023, and now I hear about the car say they are ready here. What's the anything you so you know, a better thing you know. And Emma release about on TV me through I yet. And now I yet corner say government pays 50% of arrears own us. They were yet and the better on you. So a kana abide the wayek no, it 50% pay. And last year, August 7th, wayek betu just say abide the clear. Ya kana away. Na ankwafo wayek be again wayek mano. We should bear in mind wayek exams don't conduct no. Across the whole country. And by this PA exam center no, you won't related any external devices. We yek no wayek, contractors wayek, it's your maka. That way, why to component meet your Makaye and combine a might of native more practices and also abbreviation. So we are expecting the government to be more responsible to affect this kind of minor issues. Also education sector anymore.
Sir, as I'm saying to me, I'm so abra buying chairs, I didn't so I bet me the buy a man only offers for no so, and I feel my Ghana so.
Psychologically, it will affect the country. Obi a wono akọ school nim se na fefo di kan akọ omozi etu ono no so a yesin so no omo ntro adan a ike o sa aban de ma wayek ayesa everybody no aban fan koi enu ti aban mistake no kwakwa afete akala no taase a nidia the country to develop bipolar disorder because they will be thinking about this issue and say one of the issues that almost been on Menoka say what is not think about I feel almost a conference on the process I don't hear so much in nothing on the far at beyond their strength. I come my drink, you know. I hope for a bit disappointed. Said a previous term now or look here. Now that's so nice. Even PTAs gravel. I buy a hope for the moment here. If the money may be getting here, crowd, you see and crown. This is can continue. Minia and what I buy away from 2017 capitation grant
Ababa ye areas abani nkiaye. What I say, and it will be a big disaster in terms of education. It must the government must be serious. That is when you're part of the political gimmicks now. I believe you are not going to be a damage control. No, a dire situation now. It needs urgent attention.
Opanyi mayafa twere ho na ehwe se aban betumetu aban de MCC se de e kan mene no MZ aban we na eye akoso Japan boss anwum no e de ba ro ada
awe ho pa
ti opanyi we de ya da ase panti ya be koso di sansem na chi bibie ne a ya be san afra opanyi eye William Boadi eye CEO de my Educate Africa Institute o say Ghana be suffer from bipolar disorder say 20 asa kana 93 million poly sika no modu as aban tuama wa ikontumi entua ye na nam so ma eye sa ensem we atumi asie no na mo messages na kakra e wa hase na Estebia ese news papa ya da se Paul D ese good evening PSA woni ekua mehwemo e wonzema kekam na Ghana for ese onum tumi to aba edit MPP abai we no ogu yanimu ase pa nya asem keto Paul D ya da se sabroti o Western Radio e wo eye elembele na fe nene Huago aguda was say government esa utumi etna wona so pay ye nya asem keto na toto ne mayi we ye bizaiko abusare ko say no wonder say ye atrofo minu ena eba be DMPP nim ose baulaya ena fe napolaya ena wo moba be DMPP nim tronko na wo mudi ebu oman no mkoso afa mo adwenkyere embra e won sema ye de ebremu emre pem ye be san kenkan ni na de ma high power 97.9 FM na fe TV XYZ kasafonyini so e wo enkran ena ye to apete ye gi ahome kakra ye ba me na ekua ye be san atoa Kasiebo no so.
Yes, I am a winning aqua biom Adamasamo de a year Fidiano Atua, not just Yakofa Abwa from Kraton, so about year 1 so. Not yet was the Nessa United Cadres front a Yokobia say a war NDC am Yokonum. Now Amodin Sembia to draw us as baby Aduno. I will say NDC am Yokono air come home. Now Omokabomu pa sebe na inkunim dear Betty me ayomo dear 2024 abatuano emum. Not just a year Jumedia ne Omudi a war NDC a year head office ewon krahano owura gusitando enya kwenya ekopie mu ewase na nsema odi tudwa ebi enie.
People fought for on June 19 that people were killed for because they believed in a new society, a new possibility. All those ills are back with us, even more violent, even more pervasive, even more cruel, and even more demoralizing than ever before. Corruption, nepotism, family, friends, theft, state capture, for a few, and not the many. And our people are tired. They're exhausted. Many times people say, well, why aren't Ghanaians going to standing up? Why aren't they doing this? I said, because the people are tired. They fought the hunger of 83. They fought the tragedy of the 80s and the early 2000s. People get tired. And sometimes they decide that, well, I'm tired. They should do whatever they want to do. But that can never be. That can never be. So, in this election, because all of this is related, June 19th, 31st, June 4th, tomorrow's election on December 7th, they are all related. They are about fighting to implement the principles of social justice and equity. About building an integrated, self-reliant national economy where Ghanaians control their own destiny.
Na anuachi owura Samuel Sapon no oye dwamtireni abedi akire ema NDC amyokonu ko ginemu ema owura esiedu nkatia no no so de tudwa kirem se bredu se NDC amyokonu be kom ho abom na mo ye dikanfo sense bribio mejom ho e de aka akire de okan ye eni.
This mission, as we are all aware, includes but not limited to offering sacrificial services to NDC so as to make it viable political organization in Ghana, not only for cadres, but also for generation. Mr. Chairman, as we prepare for the general election this year, we should not wait for someone else to inform us that our role is critical. This is not also the time for us as true cadres to hang on to complaints. Unity is the key at this moment. This is the time for us to put our expertise into action. And we must continue to mobilize as many forces as possible to support the party in the execution of its electoral strategies, including the Chairman General Kasiebo. Yes, and at the Consultative Assembly, we were advised to form a group in all the regions. The group used to be called Front.
Na we ayadwumedia na ekoso awo NDC Amiokono head office awon krani amotie ayowura Samuel Sapon no aye dwamtireni abedi akire ema NDC Amiokono.
Yabato ansam no so na yakọ ensem foforo mu yakọ eye poya Mantemistin region ho era achia se abato mpeso aso ore owura wono ene kura franka wo peso komra shebedwe fie ewo NDC dirimum kire se ese wono mo etumi ebo mo homoden Ghana fo nyina etumi hu se NDC ye papa echen eye NPP na hwe embre dodo a NDC etena so na hwe ne NPP fo aba nkanka ne Nana Akufo Addo ene ne bawo mi de omo ye de ese Ghana fo se so madwe na omotoma NDC efise poya Mantem NDC ba imputu eba ho owura Samuel Owusubra kwa oye achiase NDC parliamentary candidate edin same way to dwa bra na wo ya do ebi e wo Sevia Church.
sɛ mobɛdi adanse na woyɛ politics a monim sɛ mpuntuo apɔe ɛnyɛ nso akyi no mpuntuo kakra ɛwɔ constituency mu nyinaa na ndc so na ɛbaeɛ na same time bɔkɛn bi na mpp4 no atigya wɔ ahyɛ no sɛ small boy na bɛ na wobaeɛ dɛn na ɔno deɛ menim ne sɛ ahyɛ secondary school the current state in the BECE and I'm NDC so nearby. Apply senior high and I'm NDC so nearby. I share constituency go to a question and good and I'm NDC so light nearby.
Eti openya otini Kenya parliamentary candidate ma NDC ya wachiase we poemantem owura eye Samuel Owusu Brako adoye cement odeko chair Saviour Church for no chiremu se NDC bu adwuma chair MPP nti yensesa yabato num owura kokubu aten a wono ye chair mama Saviour Church kokobin circuit enso echiremu se nema 50 bucks na wode aba no ebeboa ama wono so aso dan dwumadi no atumi akoyi a wode aseda enso ema no na afi ye de aseda kase ebema eye Little George Health Shop a ede waboa yense yembo na afi yemfa Kasiebo ntufa wo Ghana fa na bia na mo so montensem pai bie wode enuro papa na ababegu na dwosuo mu ho nti enei sa wo yare na ope immune boosters ti se koa mixture ho na papa na wo ema obi nkoton fake bia emma pain relievers na face yare kwankro bi wo so na ehunduro wo pe bia wo tema ashaiman zenu ene ne mpotema ene obekotema community 5 ho na Little George ewo okwa ndo bia pe bia Mr Kill 3P garlic mixture Dominion herbal powder ukoduru ho ani nyina bi ewo ho tema community 5 PV obi run about in presby so ni ntem ho anowo frame of a Little George 0243 140213 0243 140213 ukoduru ha ndo bi te Spanish ginkgo capsules CB gina ho ye panyi na waduru panyi fie so na afi de key kura na refi udisikato ba bia na refi na okobodua anhwa wa na obewu free se ore ne fie bebe ole toye Spanish ginkgo capsules CB eboa wa ma wadwen mu ada ho fan na mogedi afusane yie no na afi ema ore fi ne ma na scan no so atoso nti ya ma menom ne ofa no mpanyimfo mo kopebi na eno achi mrante ne maba wa ne merwafo nyina betuma no webi Spanish garlic mixture and capsules antek for na na de ba ye kono bi obi otena kama na na ase atatai menstrual disorders na fe bad cholesterol ni nyina no woko Little George ho a Spanish garlic mixture nyina bi ewo ho tenatet na fe repair ba we dama pharmacy wa Shaman na fe oko pharmacy shop bi ma obenya ndupa bi 0266 114111 antek for na ma no 0266 114111 wombema we do ni bi ama bibi akonkan
Saso ana yadi asida ema eye Medimoses eye clinic and herbal center me pacho modern so beko we be mana sebe won pese prostate ebeti tu kwemu a entempo yen frihye aduana ekwa also tu America na ma na ye ntientia na utimi du ono moboa sebe ye na ise woso ubetimi enya hoden abo adwuma na etimi aboa me pacho yadi bie ha no odu eye Medimoses o mehwa ma se bia eye sexual weakness ana se bia diabetes hypertension eni yadia wodo akanyina typhoid fever ne yi ne nyina modern so bewura eye Medimoses heba etese eye center ho na omatimi abomo ndro bebre so na omo branches ahodo a obetimi akwa bi ewo eye adenta barrier so many police station no na edi animhwe so na eje kwadwo so no ebi ewo hokumase ahenema kokoben so behu omo obetimi afrom ewo 0244 068447 na woni eye Medimoses clinic and herbal center enso atwen kwantimisro se bia pese nipadua no ye hwani ye na wunya ahoden eho na wo se okono mutimi bua na so utimi ejina wo nan so eyie
yabako eye Ruta natural products aso ye na edo papa ba ko aba ewo dwaso amanfo enum bie eye Ruta nupa malaria ne hawo na wako pharmacy akwa check ye se ampa positive malaria mo wani bi wo mujema Ruta mixture betu ase deku kura de ama na edura agi award Gaftram award wo mo je na fe gina na so se e 3 dia na se bunu eduru papa no ani Ruta mixture Ruta tonic typhoid fever duru mane nkose wo yemu enema kodeko pebi onononum bia obo sa fe be hospital ni nimbiem Ruta life no boa ena ne moja ni yie mane de fusane yie eyi fi free mo wa odidi a e chance na digest ko pe Ruta life e be boa na afi aboa ma so ate ho ko jog ni nyina no na wo de no so e tache bebe eton aduro bia e wo Ghana ha obenya bi 0244 503 443 wofra Dr. Abi ebejo so ka chen so no abo da constituency se frɛ obe tie wasem ni pa enso e de amawo
Saso ana mekanfo aya let's talk educational consult edi amasa wo abofre fen wonya bosomi eye ensia ekwapem inflation ensia o se fa ne bra no ntete akwada ne ye emfa maw na esa akwada na esa na dwemu be bie esa no so mo anim de fo ne akwampa omofa so e kire nkwada ade ewo eye let's talk educational consult na etimi ebua se eba no eye public speaking and as technology and art saso and entrepreneurship ni nyina eye dioma boabo akwada no eso benyi no na akwada na itatahwe pabene babuku a eso bedi makotene pa omo teshi nungwa estate mango street eho ena eso mo betimi afro 0249069821 na onioma kasesa ne se school no ya omo makwan just tembia betimi di akwada nako na school fees ne bo no so na ofomoko a obetimi di akwada no kontimi sire so akwada mfane nhia kire nkwana mawiemu anase mane nsan fa no ko no nkire na de ma na atimi abo akwada ne daache mapa
yabako 3p garlic mixture for asoye eno eye du papa badwa so garlic ayemu ma obo ade ne pa wo mu a eboa ema mogede afusani ye wofo ekudun didi a e chance na digest eno achi utra ka mu free ha say ya samekanse wo ma kwane wa sense wo na se kwane nyenti se ya free se wo junction kra ba amasaman anase pokwasi interchange 1 hour 30 minutes eno ye ka edwane kakra no utumi di 2 hours okwan so eti o de yemfa se free ha ye ekomadina na ona se atata 3p beboa na fe ayi eno afiri ho na fe wai kese na opese o so te kama moje di afusani ye de bia me kase ye hiafo dokita no wo de na otwi bia de no bottle ba ko wa bo se ho video mo besesa kala beto so kama na fe ahode mapa watumi anya bi 3p 100% organic FDA the stamp team so kono ko pebi na fe won so well-being general well-being enkoso ye enfama stress na ye wa ko pebi little George we bi wo ho bebe to aduru bia casework na fe Ekus pharmacy Kaswa tribe of Judah na fe bebe to aduru bia fre Dr. Prince Nelson Mototi doc beton ka che Dr. Prince Nelson Mototi ne na manie 0248928824 wo frɛ na wo betumi agye so 3p ne de ye du papa ye no abi ne nyina ye no ma ye de te he
saso ana bi anyame adom se watu nso pese wo sidan na wo dwendwe ba bia benya asase ato e bia pe bi ewo Ayrshire Hills do wanya dodo wanom ene ade amepa chaw se ayikuma ne nyina no mekanfo Aztec real estate edi amasa modern so bedio na omma asase a ehojo asase a jese langas eniso asase a bibia dade na kwamu nsuo akwan ne nyina mkane a ne nyina ubenya bi ho na se atimi aboa ye pa from ewo 0244684069 na ne omonka se jese opese yema asase ombedu dwuma bibia kama edi amana so nya baby edi uti ato
Yanko Solak for Akachi, Solak Natural Clinic, a hospital ba kwa ba ye de bibidro ene san yare. Dr. Solomon Apia Kubi awa ben ewe bibidro yare hwemu ko KNUST. We nya ne maami ne wuja no na papa ne wuja mi de ni bi. Papa KNUST for ni training no. Oba ye wo lab ho ye behwehwe wo video mo hu yare kora. House abre lab technician for akoyi strike. Mr. Solak ne ko onyima ko ena fe kidney disease na say ko aman for pa baby aduru bi abra ye behwe apeduru de ama ma obesan gina na so fatty liver ye behwe wa ma ho ato ba wontumi wo onyensen na aseye be ma wa emre wo mpem eno achi urinary tract infections UTI ene mo amoko boma latrin so nyina mu nyina bibiri na wubi monko ho na monko hwe modwonso mu na enyi sa yare ni mfro na hamo na sciatica ni nyina yare ne doso hwehwe yen ewo kokomlemle ye wo Royal Castle Road ne so ho aye Ben Harvard Senior High School Dr. Ben ne do so bo for ne enam friend 055 3932631 055 3932631 Solak Natural Clinic wasem ena make kokomlemle Eben Harvard Senior High School ne na ma no kwa adwumayfo behwe okama pa
Saso ana yadi asidani bi ema eye edu heba clinic me pacho modern so beko ho na omon show se bia odihie bi ana eye stroke akana to bebi adu bi atebiri no now de fanoko na je so omon hwe no endanda no omde awidro beka na nyame adom be sori nante aye adwuma sede sefata akwa pepepe di akwana ba ebetimi aboa saso ana ode some bitters papa so ise memedro no numina gina nanso na bo adwuma me pacho 2 minutes man sa tag na da so no mesrewa pepa pepa kora fi pepa fi ho na se so atimi agina na so na aboa nti mesro ne nyina se obenya bia na se edu heba na ediaba obenya bia to bia tondro wo manga na mu bia bia obenya bi obetimi so afre no wo 0243 989 368 na se watimi ene no akasa 0243 989 368 na se watimi na akasa na fe bebia ewo bia no watimi aboa na se wo so watimi agina na so sane se enkwa ehia papa paye
nkwa sombo enyina so nso de ye Power Specialist About Hospital for Aswe na yedu Dr. Kosua Adua ya semen kanchira wo se we liver problem na wenya na wo hospital wanu mundu anoma de bia woda na wusu no se bra na so ye na sayare no yemfa ni mfichiri eduro no wo ho wo de kan wa bo se fatty liver no afede na back to normal eduro wo ho wa bibiduro Dr. Kosua Adua ya nkwa Power Specialist About Hospital ena obetuma aboa wo dompemu abu se okobo onya accident wada wo mabra ye be ka to akompo oh eno de keto akra ye de do ma ope no abenane na afi wo ho ato eno achi ulcer ena fe fibroid ye de bibido ya fa se kan kan bibia je ekoyie pa eduro no bo adwuma te se konkoma fo ejan no nyasam keto a bra ya so ye won kran wo firi ye kwabenya na okopoku ase a ye wo baabi for power bus stop on sabenkum so wo sane firi na ehwa na ye wo firi poku ase interchange na wo ba kwabenya abo ansa na obedu abom junction wo send fa so power bus stop ho ena ye wo takrade ye wo Anaji Estate ye ben Anaji Eme Primary School ena fe Kumase wo fa Lake Bosomtwe kwan na so a ye wo baabi afre ho fe yiase ye ne Josbro filling station ene di hwe ni mo bra ne be san ho yare na nso wanyina che na wo man nyina ba behwe ubi ye na mane 0244 544 422 0244 544 422 wo fra empanyifo beje so pa na fe wo ma ready sebra na yen san ho yare kama pa e ma ho nto
Saso ana aye Sabaj Heba Center enso awase enkantra sebra na ombo atese mema maye kajo muntimi nkekam hota no tese no so mokobehwa aboa musaso na emba sebi se waware ache wuntimi mfafuro embampo na asai misrafo ani akire ho hepatitis B eno so odi huduma sanso na sexual infection bia nso no obehwe atuase adiama meka se bema bi pramoja esanse kokko afifi no enyasem mantimi ntrase nyehwe momode ase obeko na ese eye kokwa duro ne ayamtim ni ade nyina di akisi yade no onto ase emfama obenya ni ndro ni nyina bi e obebi a yeton eye aduro bia oman Ghana mu na wo so watimi ano no aje ho afi yadewa ene ne ho nsansa nyina mu mepa chofre eye 050 006 4000 050 006 4000 na ese woni eye Sabas eso enkasa na ndro pepe bi omunso no yemfa emaw
na ye power corner wise fight amasama was say MPP party pa West party wa Ghana hapa wono muntumi enya ye ade papa bia me sorry so mecha Aaron Denchi ankoma wo pre Medical Students Association for wono mo president at University of Cape Coast wadwuma ba Sampa Fountain Care na face St Francis ya da munyina asente ho yenua no menua Aaron Denchi ankoma ono NS motoma no Medical Students Association UCC montomfa ma no obebo adwuma pa enso de amamo na yekoyi asada kese nkoma yesemu for na boafo Kofi Abrante wisdom edejo me na fe efua ofebia na ella wono munyina abo adwuma pa MCR team yadamase Rafne ni Mranti na fe Kofi mo Prince mo munyina wo ha mo boy ye chidom yekoyi watade fefe
ya fasida ema air Foster clothing me pacho owo teshi chi blow eho na Foster clothing e wonti misrewa se opeso pam ntade kama ema wa modern aso obeko na watimi aboa teshi eye Lekma Hospital no oni ECG district office no na edi animhwe ntimi misrewa ko na jese ontimi ensure kama 020 187 5935 na woni eye Foster clothing enkasa na ompam ntade kama enso emfa ema
atade ne de fe no kalafa ebushafo yapon yakoide na ya yebesomo midin edi PSC Okra Boys Prefect Chief Tankas honorable with that constituency minimi Wednesday sister
Akuya Kurantema
yakramo